Hey my friend, have you ever wondered how stem cells, PRP or exosomes could help you get amazing skin and sexual vitality? My friend Dr. Amy Killen shares the top regenerative medicine approaches you can use to go back in time with your skin and sexual wellness. Stay tuned for an exciting episode. Hello, everybody, and welcome back to the Anti-Aging Hacks Show. Today, I have a very special guest, and I'm actually very excited about this interview because my guest is Dr. Amy Killen, who is an anti-aging and regenerative physician specializing in sexual optimization, aesthetics, and longevity medicine. So we're going to talk some sex, we're going to talk some skin, but she's also an international speaker, a clinical practice owner, and frequent media guest. Dr. Killen has become an outspoken advocate for empowering people to look and feel their best. And isn't that what we want in this community? And then lastly, after treating a number of prominent biohackers, Dr. Killen and her colleague, Dr. Harry Adelson, pioneered the full body stem cell makeover, one of the most innovative regenerative practices or procedures currently available, which we'll touch on. And in her portion of the procedure, Dr. Killen combines stem cells and exosome injections with light, sound, and other energy-based therapies to give patients unparalleled synergistic regenerative effects for skin, hair, and sexual systems. With that said, Dr. Killen, welcome to the Anti-Aging Hacks podcast.
Thank you. I'm super excited to be here.
So you've got a street name and it's Amy B. Killen. Do you want to talk about your rap name real quick before we
Yeah, that's my
in?
rapper name. I wish I had more rapper skills and I could really make use of that name, but Dr. Amy B. Killen is my full name.
Okay, so there's no underground rap record that's coming out anytime soon.
I hope that there is. If someone could find one of me rapping, that would be amazing.
All right, folks listening, you know what to do. All right, so I understand that you were an ER doctor back in the day, and then you felt a tug and you decided to get into anti-aging and longevity. Tell us a bit about your background and why you decided to go into this path.
Yeah, I'm a board certified emergency medicine physician. So I spent about 10 years working in emergency departments, and it was a great life for a while. But after I had my kids, I have 3 kids, and I had 3 kids within 2 years. So I had all these children just back to back to back to back, and I was still working at this ER job where I had to be at work at 4 a.m, and that was tough because my husband had moved out of state for a job, and it was me and all these kids and this job that I had to be at, and it was really stressful. And I was starting to just make a lot of, eat poorly, not exercise. I was super stressed. It was never super fun to be around. And I started to see that a lot of my patients were like that too. People would come into the emergency department with these chronic medical problems that were like fatigue and stress and gaining weight and not, just not being able to deal with their lives. And I was like, that's happening to me too. So I became interested in figuring out how to kind of get myself through that. And I realized that, getting out of the ER and learning about integrative medicine and anti-aging medicine and functional medicine, all these types of preventative medicines actually was going to be the way that I did that. So I essentially transitioned over the course of several years and eventually quit the ER and then opened a practice doing some of these other things, which is what I did. I've been doing this now for about 8 years or so.
Fantastic. If a mom of 3 kids that's busy and her husband's out of state can do this and can switch careers, anybody can switch careers. So thank you for being an example for others.
Oh, thank you.
So let's get into, I just want to ask about your practice before we dive in to the sizzle part of this. Do you have a private practice where you're an owner, but you also work hand in hand and partner up with Dr. Harry Adelson at his Docere clinics? Do you want to explain that to the audience?
Yeah, it's kind of confusing. So I have a medical practice where I'm one of the owners. I'm the medical director, and you're here in Salt Lake City, Utah. We do a lot of integrative medicine, a lot of hormone replacement and bioidentical hormones. I don't see patients there anymore. I sort of oversee several amazing mid-level providers and some other great staff. But then I also work up in Park City. I do some procedures up there and do see some patients up there with Dr. Adelson doing just stem cell procedures. So regenerative procedures only for skin, hair, and sexual optimization.
Fantastic. Okay, so let's dive into the juicy details, which is we're going to start with sex first. I understand there's some problems with tissue shrinking, loss of blood flow to the genital area. We also have sensitivity, loss of sensitivity, and women complain of dryness down there. There's also, obviously, as you're an expert at some of this, there's also hormonal and lifestyle changes that can cause some of these, meaning the loss of libido and not even wanting to have sex. So are these some of the issues that you come across frequently? And what else do people ask you about in terms of challenges to their sex life?
Yeah, absolutely. I mean, as we get older, a lot of things change, and whether it's hormones, whether it's your lifestyle before that, whether it's medications or other things that are happening, we can see changes in the blood flow to the genitalia, and we can see changes in your interest in having sex, and all the things you just said. So the main things I see in men, I see a lot of men who have erectile dysfunction. It can be mild, moderate, severe. I have a lot of guys who don't have dysfunction also, who are just trying to kind of prevent that from happening. But the ones that do, it's almost always ED, because we see that with advancing age. Even if you're just 40, we can still see that. And then with women, it can be a lot of different things. It can be problems with arousal, libido, problems with orgasm. I don't tend to treat a lot of pain, because if it's a structural or pain problem, I tend to have them see their OBGYN and make sure that there's nothing that needs to be repaired or changed that way. But I'm treating age-related changes in various body systems as they relate to sexual health.
Okay. And is there an overarching strategy or approach that you embody, that you come at this with? For example, like, what are the big buckets or categories that you would kind of think about when you approach somebody that has an ED problem, or women that are not dissatisfied sexually?
I think that you're right on. It's not. Sometimes it's a problem with the actual genitalia, but a lot of times it's something else bigger going on, right? If it's a blood flow problem, for instance, for men, like with ED, we know that erectile dysfunction is an early warning sign of cardiovascular disease in general, because one of the main causes of ED is that your blood vessels have plaque in them, and you're not getting blood flow, to the penis. And if that's the case, then where else are you not getting blood flow? And you're kind of setting yourself up for heart attacks and strokes and things like that. So when we see ED, I don't necessarily work with them personally, but I definitely make sure they have someone else that's working with them on, what are your other risk factors? How's your diet? How's your lifestyle? How inflamed are you? How your blood sugars, those kinds of things, to try to work on that. We also work on the hormones themselves. So we know that testosterone is going to go down with both men and women, but in men, it becomes really, necessary for erections and libido. And that goes down after, age 40 or so. In women, we see a drop in all the hormones, estrogen, progesterone, testosterone, after menopause. And that can be really damaging to their sex lives as well. So we look at the hormones, we look at the lifestyle, we look at other things like how much nitric oxide are they getting? Are they blocking it with practices like mouthwash and things like that? And then, of course, do actual exams of the patient and see if there's anything else that we can kind of find out what's going on, to see kind of go where to go from there.
Mm-hmm. Sounds good. And then let's just touch on one other thing you mentioned, Dr. Killen, is that for women, it's different than men, because men are it's a kind of a linear progression down. But for women, obviously, the menopause is a big period, is a time in their lives where a lot of hormones drastically shift down. As you mentioned, estrogen, progesterone, even testosterone goes down. The ratio of testosterone to estrogen, though, shifts in a positive way for I would say, in terms of, it should at least you should get more libido, because now you have theoretically more testosterone than estrogen. But there's also other aging issues going on. There's like atrophy of the actual tissue. There's dryness going on. So it doesn't actually mean that you want to have more sex, does it?
Yeah, it doesn't. And, and I also see a low testosterone in a lot of women, even starting in maybe in their low 30s. You can get this sort of perimenopausal time where it's maybe the 10 years before actual menopause, where your hormones are just kind of doing crazy things. Your estrogen tends to be high during that time, but progesterone tends to drop. And then depending on the person, testosterone can also be low. So there's just a lot of variability with women. I mean, some women will have high testosterone, some will have low testosterone, but certainly after menopause, pretty much everything drops off. And you're right, it's really fast. It's over, a year or two period where they were all, feeling pretty good. And then they're like, oh my gosh, what is this? It's right. Funny, because I used to see a lot of hormone patients in my practice, and I would always see these women, and they would come in the very first day and they would be in such a bad mood, just angry. And I would meet them and they're angry, and they're they're unhappy with me, with the world. It's a whole thing. And I was just like, oh my gosh, what's wrong with these poor women? But then I would see them 3 or 4 months later, after we got them on some bioidentical hormones, and they would come back and they were so happy. And they're like, oh my gosh, I'm back to being my normal self. I'm sorry I was so mad at you before. That was just my menopause. And that's how it is with women. It's just like a truck hits them sometimes. And it's pretty tough. Whereas with men, it is like a slow it's a slow decline in general, although that can kind of build up pretty quickly if lifestyle is not helping with it as well.
Awesome. Well, thank you for that. So let's divide this into men and women. Let's touch on if a 40-year-old man or a 45-year-old man came to you and said, hey, Dr. Killen, I'm not feeling so good down there. If you had to prescribe like kind of a pyramid plan to say, okay, here's the base techniques that you should do that are maybe less expensive or free. And then as we go up on top of the pyramid, here's the other stacks you can add on that get a little bit more pricey. What would that look like at a high level?
Yeah, I would start with basic foundational health kind of stuff. Are you sleeping well? Because if you're not making testosterone and you probably feel pretty miserable. Your cortisol's too high. That's interfering with your sex life as well. How's your stress? Again, if you have high stress and you're not controlling it, cortisol is up, which is blocking your testosterone production and also the way it works at the receptor. So stress is a huge problem as far as sexual dysfunction goes. So stress, sleep, diet, are you getting enough protein? Are you getting enough branched chain amino acids? Vitamin D is really important for testosterone production as well, zinc, selenium, some of these things. Are you exercising? We know that just doing high intensity interval training and resistance training both can increase testosterone and burn that sort of belly fat stuff that's going to interfere with testosterone. And all of those things are also going to decrease your risk for developing erectile dysfunction. So those are kind of the basics, is just, what is your lifestyle? And then from there, I always recommend, getting enough foods with that are high in nitrates. So getting enough like beets and green leafy vegetables, arugula, things like that, because those foods can be made into nitric oxide in your body. And that's really important for the blood flow. So nitric oxide, opens the blood vessels up and lets the blood flow to the penis. And if you're not getting enough of those kinds of foods, you're not exercising, then you can have a hard time, because as you get older, nitric oxide production goes down each year. And so you don't make as much on your own. So those are kind of the free things that I would start out with. The next tier up is like maybe inexpensive things you can do. Penis pumping is a really good one for home. A lot of guys have they've heard of pumping, but they're not really, they think it's like a gimmick of some sort, but it's like exercise for your penis. And as you get older, especially if you're not having nocturnal erections anymore or not having them very often, then it's really important to think about penis pumping, because that's how you get blood and oxygen into the whole penis. And that's what keeps those cells in the penis healthy. And so if you're not doing that, if you're not having full erections, then some of those cells are not getting a good blood supply, and they can actually start to die. And that's part of what's going to contribute to erectile dysfunction. So that's pretty easy and cheap. And then kind of going up from there are some other things like shockwave therapy. I think we're going to discuss that later, but you can do home shockwave therapy, like with the Phoenix device, or in clinic shockwave therapy, like with Gainswave. And those are two different ways of doing it. And then there are also like the injectables, like platelet-rich plasma stem cells, exosomes, which we're actually, putting injections into the penis. And that's going to be kind of higher level as well. So that's kind of, and I didn't mention hormones in there, but replacing hormones is also important kind of in the early part of that pyramid.
Right. Okay, fantastic. Lifestyle, hormones, vitamin D and other vitamins, less cortisol. And then we talk about, you touched on penis pumps, we touched on sound wave, and then finally regenerative technologies, right?
Yeah.
In terms of women, would you prescribe something different than men, or is it generally the same set of tools?
It's pretty similar, actually. The first parts of it, the hormones, the nitric oxide, the lifestyle, even the energy devices. We have some different devices for women. We have vaginal lasers. We can use shockwave therapy as well for women. And then we have injections. So it's pretty much the same pyramid, just a couple of different tools for women.
Okay. And like you said, nitric oxide is very important. It's made in the endothelial cells, and it just declines as we age. And on top of that, one, your endothelium function is declining, which means your vessels are not dilating as much. And secondly, there's plaque building up, and we'll talk about that in just a second, which is like a double whammy of at least the blood going into your penis. So I guess let's go right into shockwave. Let's start there first, then we'll do regenerative after.
Okay.
And in terms of shockwave therapy, Dr. Killen, like what does it even mean, and how does it work? Can you describe that to the audience?
Yeah, it sounds scary, shockwave therapy, I think, but it's actually not. So the whole name is low intensity extracorporeal shockwave therapy. So if you look it up on Google, there are more than 40 studies at this point in looking at using shockwave therapy to treat men with ED, and it's useful for all different things. It's been used for musculoskeletal pain, for improving heart muscle after heart attacks. I mean, it's been used for all kinds of things. And the way that it works, it's a machine that sends these high intensity sound waves into the tissue, and when that happens, the body perceives that there's been some kind of trauma, and the body's like, oh my gosh, we've been traumatized. What do we do? And it sends out the signals that it would if it had actually had trauma. So it's going to increase VEGF, which is going to increase blood vessel formation and blood flow over time. It's going to increase stem cell recruitment to the area, so you can start having some regeneration. It's going to increase nitric oxide in that tissue, which we just talked about, the importance of that for blood flow. And so those are the main things it does, no matter where you do the shockwave therapy, whether it's on your tennis elbow or on your penis. And so what we can see is repair of injuries, improvement in blood flow, and in the penis, at least, you can see stronger erections, more consistent erections, and things like that. And what's great about it is it's safe. It's totally safe. It's a little bit painful if you don't use numbing cream, so I do recommend that. But it's like a 20, 30-minute kind of outpatient procedure or treatment that you can do either at home or in a doctor's office.
Mm-hmm. Yeah, it's quite a fantastic procedure, in my opinion. I interviewed Dustin Wolf, who's the founder of the Phoenix, and we'll talk about that in a second, and also Dr. Paul Thompson, who is the urologist that they're working with. And I learned a lot about this technology when I was interviewing them. And it's, again, like you said, there's so many benefits to it. It's not invasive, which means that you can do it easily, quickly, without injections or hurting yourself in a way. So there's a lot of pluses to it. How would somebody actually get this done? What's the actual procedure look like? Do you have to go to an office? Can you do it from home?
Yeah, so just this last year, that's where the Phoenix came out this last year, which is where Dustin and those guys are part of that company. And I'm not associated with them, but they did send me some devices to look at. Previous to that, you had to go into a clinic or a doctor's office to really get it done. There were some sketchy, like South Korean and Chinese devices on the market that I think I had some friends buy, and they weren't so good. But basically, you had to go to a doctor's office, and you would go in and you would do Gainswave, for instance, is a big company that does this, where you do one treatment, maybe 2 treatments a week for 3 weeks, and then you take a break and maybe do another series. And that would be something that you would do 20 minutes at a time, in and out. The benefit of that is that you're seeing a doctor who hopefully knows about ED, and they know what causes it, and they know the other contributors to it, and they know the concerns about it and cardiovascular disease and all of that. So I always recommend that if someone has ED, that they first go to a doctor, even if they ultimately decide to treat it at home, because there's to it that's not just what's going on in the penis in that moment. So you kind of want to make sure that you're really treating it properly. And the in-office devices that work really, really well, those are clinical grade machines. The benefit to those over the home devices is they can go higher on the energy pressure. So like the Phoenix device that you can get at home, the pressure only goes up to, I think it goes to 2.6 bar. But it doesn't go above that. And the machine like that I have in my office, for instance, I'll go up to 4 bar or 4.2 bar, pretty much all the time on my treatment. So I can go with a higher energy in my machine in my office. But the benefits of doing it at home are it's less expensive generally, and you have a device that you can do in your own house, which is kind of nice. It's nice and private. You don't have to go anywhere to do it. So I think that those devices are great. I've heard a lot of positive feedback, but I haven't seen any clinical studies on the home devices yet.
Right. Yeah, guys, I don't know, it's something about men walking into office and there's a beautiful lady there usually and they drop their pants and then they're like, yeah, you have to see the size of my junk. That just turns some of them off. But I also have a lot of friends in their 30s and 40s that are popping Viagra like you would not believe. Like it's just something that's really, really common to them. And I try to talk them out of it, but it's just too convenient, I suppose.
Yeah.
So when it comes to going to a doctor that you mentioned, Dr. Killen, should they go to any doctor? Because these doctors are handing out these pills like it's candy. Or should they try to find somebody that's Gainwave certified or either work with the Phoenix in some capacity, at least the clinic version of it? How do you recommend men go to a doctor for ED?
I mean, the Gainswave network, I'm a part of that network. And I think that they've got a good system of education, and that the doctors are in that are generally people, it's not all urologists. And I'm not either, but it's people who are interested in learning about these regenerative therapies and interested in learning about, ED and have taken the time to do that. So I do think the Gainswave is a great source, and you can just go to gainswave.com. Certainly, urologists obviously are the penis specialists, and they're going to really know what's going on. But a lot of them are so busy because they're busy surgeons that they are going to be just giving out pills and maybe don't have time to do, to deal with things like shockwave therapy. So it's one of those things, if you have a real problem, your penis is exploding or something like that, you should definitely go to a urologist. But I think there are a lot of doctors that can work with these machines and help this problem.
Mm-hmm. Yeah, that makes sense. I just want to touch on the home version that you mentioned. It's called the Phoenix. And for folks, we won't have time to go super deep into what the shockwave therapy is on this interview. But if you're a man listening and you're interested, you can go back and check out the other podcast I did with Dustin Thompson and Dustin Wolf and Dr. Paul Thompson on this device, where we talk about some of the background of ED and how these shockwave devices fix it. In terms of so we talked about the home versus clinic treatments. You said prefer the clinic, but once you go see a doctor, you've got a plan, you get the lifestyle factors addressed, then you can do it at home. Is there a similar device or treatment for women, like a Gainswave for women, or is that just for men?
There's not a Gainswave for women. There's not a home device, at least. Certainly, there are a lot of doctors who are using the shockwave therapy machines in the office on women also. Like, for instance, I will use them on women also. But there's not really any research that I've seen in women for shockwave therapy. But it makes sense. We've used it on all different parts of the body. It does essentially the same thing everywhere. And so it makes sense that it would work for women. And I think anecdotally that it does. But I haven't seen any home devices. And I don't know if anyone's tried the Phoenix on any women yet. They probably have. Other things for home for women, though, can be effective in a little bit different way. Like, for instance, the VFit Plus is a red light therapy intravaginal device, which I love. That basically is just it's inside the vagina. It's red light therapy, so it's increasing mitochondrial ATP production, just like it does anywhere else in your skin. And so you can get increased production of collagen. You can get improvement in lubrication, tightness, sensation, some of those things. And you can do it just in the treatment of in your own house. Also, some devices that are great for increasing pelvic floor strength. You can do at home. There are some different TINS units, for instance, for home, like the Intensity device or the Apex device, that are, again, intravaginal, and it essentially stimulates those pelvic floor muscles to like really contract, like super Kegels. And those are awesome, as for people who have stress urinary incontinence, like urine leakage when they cough, or just kind of want to get more sensation or more pleasure, then those kind of things can be really great too. And that you can just order online, and you can do it in your own living room or your bedroom or wherever.
Living room. As you're Netflix and chilling.
Exactly.
Right. I've actually tried the Phoenix at home, and I have to attest that it made a positive difference. And you're right, for men, we don't realize at all that things aren't perfect like we were when we were 25. Yeah. And so they kind of like creep up on us. And then when I tried this, I believe I did 6 sessions. It was just like things were just flowing, like for no reason. I was like, "What's going on down there? Why are you so excited? Like, relax." So I can say that it's definitely there's something to it. It definitely works. Obviously, I was also doing a penis pump with it, which is what a lot of practitioners recommend, along with using a shockwave device. And so, is that a synergistic view in your perspective, Dr. Killen, that the shockwave is knocking out the atherosclerosis plaques and then creating new blood vessels, and therefore then you need the blood flow to come in, and the penis pump traps your blood into your penis, thereby giving you benefits of both?
I think that, we know that pumping by itself is also helpful. So I feel like, they work in a little bit different way, but anytime that you're encouraging blood flow, like when you're pumping, you're encouraging blood flow. And if you do it enough, then the blood vessels, they actually will create new blood vessels because you keep forcing blood into that area, right? Like your body is very smart. So that's, I think that it makes sense that it would work together. I haven't seen any published studies that have looked at shockwave therapy alone versus shockwave therapy with pumping versus pumping alone. I haven't seen that done, but we know that both modalities are beneficial. So if you put them together, I think that makes sense that it would work.
Okay. And I've done that by itself as well. I don't know what you biohackers keep doing all day, but that is also beneficial just by itself without anything else, at least for me. I don't want to make any claims. All right. So let's go touch on the next thing I wanted to ask you. I want to go back to the regenerative technologies, especially some which you're very well versed with. And we want to talk about PRP, we want to talk about stem cells and exosomes. So how would you describe, at least in sexual wellness and sexual health, what do you use, and for which scenario would you use one or the other?
Similar to the shockwave therapy and penis pump, we don't have any comparative studies that look at PRP, in the penis versus exosomes versus stem cells in humans. And so we don't really know how much better one is versus the other. There's a lot of sort of anecdotal stuff. And I've been using stem cells for 6 or 7 years, exosomes for about 3, PRP for 8 or so. So I've been using all of these things for a long time. A lot of it's the patient's comfort level. So, PRP is really easy. We can just get some blood, we spin it, we essentially put that blood right back in, and it's fairly low cost. And I say that it's not nothing, but it's the cheaper of all the options. And it's been around for a long time. And so that's something that I think is an easy first step, whether that's with penis injections, the O-shot injections, or, other things like skin injections, et cetera. The stem cells, if I'm going to use stem cells, generally I'm going to get them from the patient. So I'm using autologous stem cells. So that requires a procedure to either bone marrow or fat to get those things out. So it's a little bit more intense to do that, right? But you're getting to use your own cells, which is kind of cool. As long as you're young and healthy, and by young, I mean less than, 65 or so, then that I think works well. And there's some studies to support that. And then exosomes are pretty new, but they seem to work in a similar way as stem cells. And animal studies have shown us that, at least with ED, they're just as effective as actual stem cells when injecting into the penis. So those are great because they're just off the shelf. We buy them from a lab and you can use them. So I talk to the patients about the different things, what we know, what we don't know, the different prices someone else goes over with them, and then kind of their comfort level. Like, are you okay with getting exosomes from another person? Some people are not. Are you okay with doing a bone marrow aspiration or a fat procedure, fat liposuction? And then some people are not. So it's really about personal preference at this point, because I can use all of them or none of them.
Right. They're all regenerative technologies, and we don't have clinical data on what's better than the other, like you said.
Exactly.
In terms of PRP, so what you're doing is you're drawing a patient's blood, you're separating the platelets, and therefore that plasma that's remaining at the end has a lot of growth factors. That when you inject back, it attracts, as you said, stem cells and other growth factors that heal the injured area, and rejuvenate your body. I've heard of some practitioners, or I've talked to some practitioners, at least in the hair loss space, that like to mix placental extracts with their PRP to make it even more efficacious. Is that something you've come across? And if not, what are your views on it?
I've used amniotic, like amniotic placental fluids. Yes. And that's something, I've used a number of exosome/amniotic products. The exosomes live in the amniotic fluid, and essentially the products contain both. The ones that are initially used for hair were a thicker kind of extracellular matrix kind of product, and those are still being used for hair. I haven't used that in the penis, but I have used all manner of other types of amniotic products. And I think that the growth factors that are in there can be beneficial, but we just don't really know, because the hard thing about amniotic products is there are so many brands out there, so many, like, I get people coming to me all the time telling me about their amazing, one of a kind amniotic product. And we just don't, there's not testing on all of that. Like, we have no real studies on each of those particular products. So I try to stick with like 1 or 2 brands that I know, and just kind of deal with them. And then I'm gathering my own data, as I go along.
Yeah. And I think what folks that are listening have to realize that this is still a new space. We don't have a lot of data. There's a lot of new entrants. The FDA is finally cracking down on some of the exosome companies to clean up their act, which is good. But in the days and years ahead, hopefully we'll have better data on this. And then coming back to PRP, that's also subjective, because this is coming out of your own body. So how good are your platelets on the day that we're drawing these? Like, did you eat a fatty, like McDonald's for the last 3 days? That's going to affect how your platelets show up. So you've got to also have your body be cleansed before you come in to draw your blood and spray it on your face like the Kardashians do. Okay, so PRP, We talked about exosomes. Would you just explain the difference between exosomes and stem cells for people that don't know?
Yeah, absolutely. So, stem cells are the cells in your body that are responsible for keeping your organs, up to date, for repairing injuries, things like that. And they can replicate themselves and they can differentiate, which means turn into other types of cells. The way that stem cells work. So, for instance, if I take some stem cells from your bone marrow and I put them in your face or your penis or wherever, the way that they work is that they actually release these little exosomes, these little tiny bubbles of information. They release those bubbles and the bubbles float around and they get taken up by other cells that are already in your skin. So your cells that already live there take up the exosomes, and the exosomes contain within them things like growth factors, cytokines, messenger and microRNA. And the messenger and microRNA are these blueprints for protein production. So when your cells that are already in your face take in these exosomes, wherever they came from, they actually can, it seems they can reprogram the way that your cells are behaving and make your cells act more like more youthful cells, because they have that blueprint for protein production. So like the exosomes we use are coming from placental stem cells. So like umbilical and placental stem cells from healthy babies, like C-section babies. So they're very young, they're very robust and ready to go. And so that's something that we use. But that's what exosomes are. And even with stem cells, just to kind of make this clear, when we use, stem cells themselves, even if your own cells, they're not going to engraft in the tissue. So they work just by signaling the cells that you already have there to become more active. And then they stay there for a day or two, maybe, and then those cells go somewhere else and eventually get absorbed by your body. So when we're using stem cells, we're not trying to have those cells turn into a different type of tissue. We're just trying to take advantage of all of those great growth factors and signals that they have within them.
Mm-hmm. Yeah, that makes sense. Now, in terms of where you extract the cells from or stem cells from, you mentioned a couple of sources, which is cord blood or your fat. Are you able to do both? And I guess I'm asking the second question because there's a stem cell clinic in Florida that got shut down because they were storing stem cells from fat, but that doesn't seem to apply if you're doing it immediately, if you're applying them immediately, correct?
Well, the FDA does not like us using stem cells from fat. They are, in fact, they're going to rediscuss in May of this year whether or not they're going to make all of us stop doing that. But their position is that if we take fat cells out of your body and we essentially, just take out the fat cells and keep the stem cells and put the stem cells back in your body, that we've created a drug, even though it's your own body and it's your own tissue. And that by doing that, they should have regulations over that. However, somehow they're okay with us using bone marrow stem cells from your body and doing something similar. There's a lot of language in there that matters, but essentially they right now are generally okay with bone marrow stem cells from you. They're not generally okay with fat derived stem cells from you, but that's still kind of to be determined. But they're definitely not okay with taking any cells out of you, culture expanding them, growing them in petri dishes and getting more and more and more of them, and then putting them back in you. And that's something that we can't do in the US and we haven't been doing for a long time. But that's why people go to Panama or Costa Rica or other countries that really have people who have a lot of severe medical, systemic diseases will oftentimes go out of the country because they can get higher doses of stem cells in those places.
Yeah, absolutely. Okay. I want to round this out, but I do want to ask, we talked about exosome stem cells, PRP. We talked about men, I guess, but does this apply for women as well? Can you inject it into the clitoral tissue and down there in the genitalia?
Yep, exactly. So we do inject into the clitoris. I inject into the anterior vaginal wall, which is kind of where the G spot is. If there is a G spot, that's to be determined. But anyway, it's that area. In women, actually, you can inject generally anywhere. Like I've injected several areas down there, but that's a classic O spot, O shot.
Okay, got it. In terms of price, what is the best bang for the buck currently, given the data that you have? What should people do?
I would say that there's the most evidence. I mean, you mean the regenerative things of PRP and stem cells and exosomes? Oh, it's so hard because right now I'm favoring exosomes a lot. I think it's because they're so easy and there's just the evidence so far that I've seen is is similar to actual stem cells, but there's just not a lot of data out there about it. So I can't say for sure. I guess from a low cost and plethora of information standpoint, I would say PRP is probably a good place to start. But if you have the money and you have the time and those kinds of things, then I think that stem cells and or exosomes are fabulous.
Okay, great. Awesome. So let's move on. We talked a lot about the sex. Now we got to talk about skin as well. But before we leave sex, I guess you touched on V-Light for women, which is basically red light therapy that you can insert, and that tightens the collagen, gives you some mitochondrial energy so cells can do their job better. Is that correct?
Yeah. VFit Plus or VFit is something you can get, and there's several. There may be other devices out there now. That's the one that I've seen, but yeah, exactly. It's great. It's very relaxing. It's super mellow and can be pretty effective.
Okay, fantastic. Okay, Dr. Killen, now we're moving on to the skin part of the conversation. And what I want to know from you is, of course, collagen, as we know, is the majority for skin, and collagen starts to decline. I've heard by up to 40% by the time we're in our midlife, which seems scary. So what are some of the tricks and techniques that you use and you recommend to people to have beautiful skin, not only now, but also into our 70s and 80s?
So yeah, you're right. Collagen really starting at about age 25, every year you make less and less collagen, and every year you break down more and more collagen because things like UV light from the sun and pollution and toxins and all of that actually breaks down the collagen in your body. So the first thing you do is try to protect yourself from all of those things. I wear sunblock every single day, even if I'm sitting inside like right now and it's snowing outside, because still there's light coming in. And you can argue about how beneficial sun is or isn't, but I would say that I will tell you it's the number one cause of skin aging. And so if you care about your face and your neck and these things like this, then at least put some sunblock on right here. That's the main thing. I am in favor of good skincare. I'm in favor of, good antioxidants, vitamin C, vitamin E, things like that. I'm in favor of retinoids, which is also debated by some people, but there's a lot of research behind that. So just, using a daily retinoid, like a retinol or a stronger retinoid before bed. And then I like to do a lot of procedures on myself and on patients. Microneedling is great. It's very easy. You can do it at a med spa, and you can do it with something like vitamin C cream or hyaluronic acid. And it's just like little needles that make little tiny holes, in your skin, but that induces collagen production by itself. And it offers a way to get things like serums into the deeper layers of the skin. So you could also do derma rolling at home, which I'm a big advocate of. You can get a derma roller, 0.5 millimeters is probably good, and just do home treatments like once a week and put on your favorite skincare afterwards. And that's something really easy, really cheap, and you can do it, just by yourself. And then from there, there's all kinds of other things. There's tons of different lasers, radio frequency devices, things like that, kind of depending on what you want. And that's a whole other thing. And then there's all the regenerative stuff, the PRP, the exosomes, the stem cells, which we can either inject or we can microneedle and then apply topically, or both.
Oh man, you opened the Pandora's box here. I could ask you 100,000 questions.
I know.
But I got to be respectful of your time. So let's tackle a couple of things you mentioned. Number one, so I'm taking that you follow the Cindy Crawford approach to your skin, where you wear sunscreen even when it's, not so much light outside. So I get it. I was expecting to hear your opinion, because you straddle the biohacking world, the doctor world, and somebody that wants to look good for a long time. So the biohackers are out there getting an hour of sun every day and maybe 2 hours, and that's okay. More power to them. But at a certain point, I want to look good when I'm 75, when I'm 85. So I don't want to burn my skin and then use 10,000 lasers just to kind of correct what I've done. Right. So there's definitely a middle path where you, like you said, save your face and your skin and this area, the upper neck.
Yeah. Décolleté, you call it.
Décolleté, yes. I don't know how to pronounce it, but décolleté. But then you can expose your back and your legs and whatnot. So maybe there's definitely a middle ground. Okay, let's talk about, you touched on microneedling, and I've been doing this recently more and more from home. I've been doing 1 to 1.5 on my face every 3 to 4 weeks. Yep. And then I'm going to do some lasers. But I know estheticians at least want you to go into the clinic to get microneedling because it's done by a professional. They're using the right roller. I understand all that stuff, but is it safe to do from home? And if so, is there a certain medical grade needle that you need? How should people approach this?
If you're yes, the dermatologist, they'll all say don't do it at home. I say that as long as you're smart about it and you don't go too deep, you don't want to draw blood at home. Like you don't want to be like a big, Kim Kardashian bloody mess at home. Like you be smart about it. But if you're going, I would say for most people, less than 1 millimeter is going to be safe at home. Definitely 0.5 should be fine. And you always want to, really clean your device, whether you're using a derma roller or a stamper, or even, there's some like Alibaba style microneedling devices. You want to always make sure you're cleaning it with alcohol or similar, and you'd never want to share these things. These are needles, like use your like common sense kind of stuff. You always want to clean your face really well before you use it as well. Cause you don't want to cause an infection to happen because you didn't clean something properly. If it's over about 1 millimeter, depending on your skin type, then you may want to go into a doctor, for deeper treatments. In someone who's pretty young and healthy, like you, for instance, you may be able to go 1.5 millimeters and you're not going to get blood and you're just going to get a good treatment. Versus, someone who has older skin, even 1 millimeter is going to be a problem. So you kind of have to just be a little careful about that. But I think you can do it at home if you're smart.
Okay, perfect. Thank you for doing that. Yeah, I think if you clean it right, like you said, use alcohol, the risk of infection is super low. But you have to be smart about it. You just can't be, like you said, sharing needles or not washing your face and then trying to inject.
Don't go over active acne, for instance, and spread it all over your face. I mean, just, things like this, you just want to think about.
Yeah, absolutely. Okay, there's more things you mentioned that I want to ask you about. But before that, I've been studying microneedling for the last 1.5 years, maybe 2. I've been doing it on my scalp, certainly for hair. And I've been doing it on scars that I've had, and those are starting to go away as well. But I've also started doing it on my face. So I just love it. And some of the benefits of it are that it lightly injures your skin so that your skin can lay down new collagen, can create new blood vessels, and can get oxygen, nutrients. And then when you apply topical vitamin A, C, E, even some copper peptides, it can really help smoothen out the skin that you haven't had smooth for a long time. And in fact, some scars I've had, when your scar becomes shiny, because there's too much collagen laid out, the shine has gone away and the scar has literally gone down almost to skin level, which is fascinating. I didn't think anything could do that.
It's great for scarring. It's great for, you gotta be patient. You gotta do it a lot, but it's really good for scars.
And it takes time. It's not like you can do 2 or 3 times and you're good. It takes time. Okay, let's move on. We need to get to stem cells and exosomes and PRP for the skin, but you mentioned a couple other things, lasers and radio frequency. So let's talk lasers. I've been doing a little bit of research and I'm like, man, this is going to be my first laser. So let's go as strong as we can. So I'm thinking of getting an ablative, like a CO2 fractional maybe, but an ablative, like burn it to the ground. You
look so young. I don't feel like you're going to need an ablative laser. I feel like you need like something gentle because you don't even have any, like you're super young.
Thank you. You're too kind. You're too kind. But okay, let's walk through somebody who's maybe like just starting to think about lasers, 35 to 40 years old. What should they consider and what type of lasers should they be inquiring about?
I mean, there's so many lasers out there and so many brands that I would say that the first thing is to find a good doctor that you trust, that you could walk through like what they have access to and what they recommend. Because it's like the largest discussion, but sort of low level or fairly easy things you can do, like a non-ablative fractional laser is something that I have in my office, which is going to, it has little holes, pokes little holes in your skin with the light, and you get a little grid pattern afterwards, and it can induce collagen and skin, tighten skin over time, but you're not like crazy looking for more than a couple of days. Like you don't have to like hide in your house for 3 weeks like you do with an ablative laser, like you're talking about. Ablative means that it's essentially taking off a layer of your skin, right? That's what a CO2 laser is, an ablative laser. And that's the one it's pretty severe because it's like almost like burning off a lot of your skin, and then it comes in over the course of like 3 weeks or so, and it's like this fresh baby skin. So that's like a pretty invasive thing. Non-ablative fractional is down here. And then there are all different levels kind of in between here of like radio frequency microneedling, for instance, is really cool because it's microneedling with radio frequency. And so you've got the heat plus the needles. And so like a Morpheus is like that. And that's kind of a mid-level. It kind of hurts, but there's not a lot of downtime from it. And so there's all different gradations of lasers. And then there are other lasers that are just for pigment, like IPLs, for instance, are great for getting rid of hyperpigmentation. So short answer is talk to your doctor and see what they have access to and go from there.
And like I've been to some beauty shows in Las Vegas, and I was shocked by the number of laser manufacturers just pimping out their laser device. I'm like, how is there 80,000 lasers? What do you guys do? I don't
Yeah.
understand it. And they all cost 150,000 or so. So it's very expensive.
Yep.
And the dermatologists are the super experts that they invite on to the panels to speak about their lasers. So it's just it's fascinating to see what's going on. But yes, I agree. Lasers, I'm going to start using them in my arsenal at least once every year. So maybe I won't do ablative based on what you said, but
maybe do, you know what I would do for you? I would consider doing like ultherapy and thermage combination like once a year. It's kind of a more of a preventative thing. And there's no downtime from it usually. And it hurts a little bit, but other than that, you don't look crazy afterwards. And that's something that you could just kind of have on your schedule, once a year to do.
Okay, awesome. I actually went to South Korea in 2019 when the world was normal to just kind of meet some of their dermatologists. They've got this district called Gangnam. By the way, Gangnam looks exactly like New York City, but a cleaner version of it, which is crazy. But there's this district called Gangnam, which has 2,000 dermatologists, like plastic surgeons, right back to back. And you're just like, whoa, this is like this epicenter of this world. And they told me the same thing to do thermage, and I haven't done anything a year and a half later, so I need to start moving.
Yeah.
Okay, so thank you for that. So we talked about radio frequency lasers. Let's go back to what we were talking about earlier, stem cells, PRP, exosomes, with regards to facial décolletage. Is that how you say it?
Décolleté, yeah, neck
décolleté.
And décolleté is like this area.
Décolleté in your face. What would you do as people are 35, 40, and then beyond? How would you approach this?
Again, it depends on what they're wanting to do. But a lot of times with my procedures, if we're going to use any of the regenerative things, whether it's stem cells, exosomes, PRP, I will generally look at their face. I will inject some of it. So I inject underneath the eyes and around the mouth and any areas where you start to have like, thin skin or thinning skin, I'll inject into a little bit deeper areas. And then I'll go over the whole area, the whole face, the whole neck, everything with the microneedling at a deep setting, 1.5, 2 millimeters. And then I'll apply everything topically. Things like stem cells, if you apply them topically, obviously aren't going to get in through the skin barrier if you haven't created those channels first. So the channels help that get really into those deeper layers. But I just doing something like that with just some injections and then the microneedling and topical application of those regenerative things is great. You could also do them after a laser treatment. So for instance, if you did have CO2, and there's actually some really cool pictures on the Chimera Labs website you may have seen, but if you have a CO2 laser or something like that, if you're able to put a layer of exosomes or PRP or stem cells or something on top of that sort of open wound that you've created, then there's a lot of evidence that you'll heal a lot faster and have better results. So you can use them in conjunction with lasers as well.
Mm-hmm. Is there, and I'll ask you this, I know we don't have data, but is there one that you prefer over the other two? Is it exosomes then?
I'm kind of on an exosome thing right now, but I still, I love stem cells because I think that they work well as long as the person is healthy. But what I do in my practice is I combine them together. Pretty much everyone is getting stem cells and exosomes. That's not, I don't think, something that everyone can do everywhere, but that's generally what I'm doing. People who are coming in to see me are generally coming from other places, and we do kind of bigger procedures, and I tend to use kind of a kitchen sink approach with those patients.
Okay. Yeah, I interviewed our common friend, Dr. Duncan Ross, last year in LA, and we did a exosome treatment on my face. We did the microneedling, and then half of my face, we injected the exosomes into the skin, and the other half, we just topically rubbed them on so they could just kind of go through the microchannels. So it was very interesting. I looked like Two-Face. The one part was like beat up with the injections, and the other part was kind of okay, but also beat up from the microneedling.
Yeah.
Do you have a perspective on like injecting these exosomes for stem cells or just layering them on topically after microneedling?
I think the best is probably doing both. Like injecting, you can't go quite as deep with microneedling, so you can go a little deeper, but you really want to just be in the dermis most of the time, which is not that thick. So I think that if you can do both, then that's great. I have a video of myself injecting myself with exosomes that you might have seen, and it's not hard. It's super easy. It's a little bit painful, but it's not a big deal. And then the microneedling is not painful as long as you use numbing cream. So I like kind of kitchen sink. I like to do as much as you can while you're there.
Yeah, absolutely. I mean, if you have the resources, absolutely do all of this, right? Because you're investing in yourself and you're investing for the future, for a better you. Unfortunately, this is not a case of a medical practitioner hiding information from you. We just don't have clinical data to say this is the way to go. Exosomes are definitely better than stem cells for PRP. So again, use your resources wisely, but at this point, seems like doing more is better than doing less if you have the resources. Yes, and I did see your video a couple of years ago of you injecting exosomes into your face. I'm like, oh, I need to do this, and I've been trying to do it or muster up the courage to do it for the last 2 years, but I'm afraid that I'll hit like a nerve or a blood vessel under my eye, and it'll be like red and poofy for weeks.
I definitely don't recommend you do it at home. It's funny. So I've done 2 videos. I did a PRP one where I injected pretty deep, in my skin. And I did a more recent one with exosomes. And I got all these people messaging like, how can I make PRP in my garage and inject my face with it? And I'm like, no, that's not what I'm telling you to do. So I'm not telling you to do this. I'm telling you not to do it, but go see a doctor who knows how to do it.
In fact, I have a PRP machine that I bought. It's one of the good ones. Because the one thing people need to know about PRP machines is there's a huge variety, and your local derm down the street may not have the right kind. I'm just saying this to you.
That's definitely true.
You want to make sure that the machine is professional grade. The kits, the amount of work you have to do to get a kit for this machine, my God, let me tell you, like it's been a pain. So they're definitely not easy. If you're getting these on Amazon, do not use them. They're like a puff of wind. You might as well just microneedle at that point. That's my humble approach, or my opinion. Definitely go to a professional that has a good machine that know what they're doing when it comes to PRP. Or buy your really high-end machine, which I don't recommend either. But okay.
No comment. I'm not making any comments on that.
Yes. So there's certain areas of the face, Dr. Killen. There's under the eyes. Obviously, there's this area, the smile lines. And then there's obviously the jaw, the jowls that drop down. When you inject these regenerative technologies, will they help in all those areas, or they're better suited to one or the other?
They can help in all the areas, but what they're not going to do is they're not going to create a lot of volume. So for instance, if you're older and your cheeks you've lost volume in your cheeks and they're kind of sagging, and what you need is actually volume, that's where something like a filler comes in, like a hyaluronic acid filler or something similar that's actually going to be able to create volume and keep it there for a while. The regenerative skin therapies are great for improving the health of the skin. So color, tone, texture, pigment, mild tightness, kind of things like that, but they're not going to increase volume a lot. So that's, sometimes doing several things at once or over the course of several months is going to be needed depending on, how much aging you have and what your concerns are.
Yeah. Looking beautiful in your 70s is definitely not a cheap endeavor. I'll say this. But
you better start now. Like it's one of those things that the earlier you start, the easier it is though.
So do the CO2 ablative is what you're saying. Okay, let me ask you a different question. So we talked about the areas of the face that kind of get depressed as the aging process continues, and you want to lift them up. And you mentioned fillers. What fillers there's a lot of fillers on the market, and they're confusing as hell. Is there one that you recommend that doesn't leave a residue behind, that's unnatural residue, and kind of helps or encourages your own body to maybe help it along as well, both sides? Is there something out there on the market, or do you have to put something in that kind of sticks to your skin and it's not natural?
You have to, all fillers are going to be some degree of not natural. There are some like Sculptra, for instance, or Radiesse, which are going to trigger your own body to increase production of collagen over time. And so that's something that can be great. You can, it can look really natural because it is your own body, but it's still triggering that to happen. Other fillers, the more common ones like hyaluronic acid fillers, which is like Juvederm and I just forgot the name, but Juvederm and those kinds, which are very common. Those are hyaluronic acid, which is something that's already in your skin. It's just a little bit different. It's cross-linked differently than what you have in your skin, so that it'll stick around longer. Usually that gets absorbed by your own body within a year, depending on the filler. But there are always cases of people who have reactions to any kind of filler. Like, it can cause allergic reactions, or it can cause little inflammatory nodules and things like that. So there's a risk with fillers, but they're also, they're used every single day, and they can be very safe. It just depends on kind of your level of comfort with that.
So when you just said that, would you maybe recommend a hyaluronic acid filler over the others, or are they roughly the same?
I think that they're very different. Sculptra, which is great, it was actually developed initially for AIDS wasting syndrome. People who had just wasting of their fat and needed volume everywhere. And so you essentially could inject it all different places, and it creates just sort of a general volume, versus like a hyaluronic acid filler, you're generally putting it in one place. Like you're putting it in your cheeks, or you're putting it in your nasolabial folds. The benefit of hyaluronic acid filler is that if you get it put in and you don't like it, then there is something that can dissolve it. So we can essentially just do another injection of the enzyme that dissolves it, and then it goes away. So that's the good thing about that one, is that if it's messed up, then you can get rid of it. Mm-hmm. So, again, I would go to a dermatologist or plastic surgeon who knows what they're doing, who has access to all of the things, and then can look at your face. And because there's really, this is a very artistic kind of thing. It's very different than like the stuff that like the PRP, the stem cells, that sort of thing. Once you're a good injector, where basic anatomy is, you can inject anywhere, and you're not going to ever mess someone up for the most part. But with fillers, you can, and you can cause blindness, you can cause all kinds of problems, and you can cause people to look crazy. So I would go to someone who has a good reputation, who is very artistic, and who has access to all the tools, and they can choose which one's best for you.
Yeah, that makes a lot of sense. We've all seen people that look a little bit crazy, and you wonder what's going on. Okay, I know we're coming up on time, but I want to be respectful. But I have a couple more questions for you. You also do, well, before that, you look very young, by the way. What is the Dr. Amy B. Killen protocol for skin?
I think it's most of the things we've already talked about. I whatever I do on patients, I've had pretty much all of it on myself, and I've not been shy about the things that I do on myself. I do all therapy and thermage once a year. I've done fillers, I've done Botox, I've done microneedling fairly often, a few times a year. I've done all the exosomes. I basically have done all the things. And then of course I try to eat well and live well and exercise and all that. So I do what I can get my hands on that I think is going to be effective, because I think that there's, it's hard to stop aging, and it's tough, but I don't think that's reasonable for everyone. But that's my approach is I'm all in.
Yeah, absolutely. And you're the owner of a medical practice, and you work with Dr. Adelson very closely. So I'm sure you have access to everything at your fingertips. It's easier for you in some ways. Speaking of, let's get into that last segue of you helping or doing taking part in the full body stem cell makeover. Please describe that to the audience. How does that work?
So that's a procedure Dr. Adelson and myself put together that basically and we inject stem cells, exosomes, into all the major joints in the body. That's my partner's part. So that's, all down the neck and back, the shoulders, the elbows, the wrists, the nips, everything, hips, knees, toes, all the major joints. And then at the same time as that's happening, I inject the hair for the scalp for hair regeneration, the face, the neck. I do all the things we just talked about. I do the sexual injections, the shockwave therapy, or the laser. So essentially it's like this full body stem cell makeover. We also do IV stem cells or exosomes at that same time. It's all done under anesthesia, and it's about a 3-hour procedure. So we have been doing this probably, I think Dave Asprey was our first patient back 3 years or so ago. And it's been phenomenal. We've had people, coming in from all over the world to get this done, because it's, as far as we know, the first, kind of the only thing of its kind that's being done right now.
Yeah, it seems like a fascinating procedure. I've heard of it. But I also need to pay my rent right now, so I can't come do this. What can you speak about the cost at a high level for this procedure?
That procedure is expensive. That procedure for the whole thing for both of us, and the anesthesia and all the products, is about $45,000.
Okay, all right. So it's motivation to make more money, folks. So you can come do this procedure every once in a while. All right, Dr. Amy, thank you so much. Where can people find you online?
So I'm very active on Instagram, Dr. Amy B. Killen. And I have a couple of different websites, but dramykillen.com is probably the easiest to start with. Got some YouTube videos on Amy Killen MD. And just, if you put my name in, you'll find me. I've done a lot of podcasts and things, but Instagram is my favorite. So come see me there.
Okay. And she's going to be joining me on Clubhouse for a few sessions as well. So come see us there as well.
Yes.
Yeah, Dr. Killen, thank you so much for your time. I know that I've taken up a lot, but you have added so much value, and I hope the listeners can just listen to this interview a couple of times because you dropped a lot of really cool tips in there. So thanks again for coming on the Anti-Aging Hacks Show.
Thank you. Bye, guys.